to South Africa, where a study by the Waits Reproductive Health and HIV Institute shows that long-acting injections among women in sub-Saharan Africa were 89% more efficient in preventing HIV/AIDS compared to daily tablets of pre-exposure prophylaxis. But despite its effectiveness among women, experts want to conduct more clinical research before it can be made available for public use. Here are more details of that in this report.
One injection given every 2 months has proved to be 90% more effective than a daily pill at preventing HIV in women. A study by the Waits Reproductive Health and HIV Institute has revealed. The study was conducted on over 3,000 HIV-negative women in 7 countries in sub-Saharan Africa.
As you know, particularly in this region, more than half of women are infected with HIV. New infections are in HIV, and women bear a disproportionate burden of HIV in our region. Although we've had access to oral PrEP, I think the finding that injectable PrEP is so much better than oral PrEP really means that we have an additional option that will fit into women's lives and hopefully help us roll back the tide of HIV.
Having an alternative to taking daily pills could be a critical intervention for individuals who struggle to take the pills due to stigma or other privacy issues.
Taking an injection 8 weekly is far easier for many women than taking a pill a day, and overcome some of the challenges that they've experienced, which are both related to just the habit of taking a pill a day and remembering to take a pill a day, but also the social pressures that come with having bottles of pills around.
More studies are expected to take place before the regimen is made available to the public.
There are additional scientific and clinical questions that we still have to answer. So we're not looking at something that's going to be available immediately. But clearly this is going to be fast-tracked both from the clinical research point of view and the manufacturing side. Because access to this for a country like ours, with such high numbers of infected young women and new infections every year, it could be a game changer.
The results of the study have been hailed by many in the health industry as a milestone for prevention of HIV among women at risk of HIV. Once the injection is available for public use, it will help millions of women and girls in this region. According to UNAIDS, women and girls in sub-Saharan Africa account for at least 59% of all new HIV infection cases.